This video is a demonstration on how to don or put on and doff or remove personal protective equipment, PPE, and the sequence in which it should be done. The first step is hand hygiene. Hands should be either washed with soap and water or sanitized with alcohol-based hand sanitizer. Next is to put on the gown. This is a standard gown being used. It has a hole to pull over your head. Next, you want to place your arms in the sleeves. In this particular gown, it provides thumb holes, which should be used in order to prevent any skin from being exposed. Make sure to tie the gown in the back. The next article of PPE to put on is the mask. Surgical masks are used for staff and family members entering droplet isolation rooms and for patients being transported that are under either droplet or airborne precautions. The N95 mask should only be used by staff that are entering airborne isolation rooms and have been fit tested. In order to protect yourself, you must use the size that was determined for you during your fit testing. It is important to remember to squeeze the metal bar around the bridge of your nose to help seal the mask on your face. The last article of PPE to don is your gloves. Make sure to pull the gloves over your wrists, covering the sleeves of the gown. There should be no visible skin. Now we may enter the patient's room. Once we have entered the patient's room, we are now considered contaminated. Before exiting the room, we must remove all PPE except the mask if one is used. The CDC has recommended methods of doffing or removing PPE. We will demonstrate both methods. In the first method, the gloves will be the first item to be removed. Start by pinching and pulling off one of the gloves at the palm of the hand. Once removed, ball up the glove in the palm of the gloved hand. Now take your exposed hand and slide your finger under the wrist portion of the other glove and pull it off. Dispose of the gloves in the trash. Now, reach behind your back and untie or break the tie to remove the gown. To prevent contamination, you want to roll the gown off and away from you, remembering to only touch the inside of the gown. Now take the rolled up wadded gown and dispose of it in the trash. The second method consists of removing the gloves and gown at the same time. With the gloves still on, grab the front of the gown at the upper chest area and pull off and away from you. Roll the gown forward, making sure that the contaminated part is being rolled within the gown. Once the sleeves are at the level of the gloves, pull the arm and hand out of the gown and glove and continue to roll off of the body. Take the wadded containing gloves and dispose of them in the trash. Next is your mask. Always remember that the front of your mask is contaminated. The mask should always be removed from behind using the ties or elastic band. Now dispose of the mask in the trash. The last and final step is hand hygiene. Alcohol-based hand sanitizer is acceptable to use unless your hands are visibly soiled or you are exiting a room of a patient with C. diff precaution. Don't wear masks around your neck or under your nose. If you are using PPE, it must always be worn appropriately. Once you have pulled your mask down from your nose and mouth, it is considered contaminated and must be removed and replaced with a new mask. Do not remove PPE in the anteroom. Removal of PPE should occur at the door before exiting the patient's room. Do not wear PPE in the hallway. These are the minimum requirements for each type of isolation. Additional PPE, such as a face shield, gown, and mask, can be added for procedures which might generate splashing or aerosols. Standard precautions should be applied to all patients. For droplet isolation, use a surgical mask. Gown and gloves should be worn if the healthcare worker is touching surfaces where droplets may have landed. For airborne isolation, use an N95 mask. For contact isolation, use gloves and gown. PPE should be worn when there is anticipated exposure to any blood or bodily fluids, regardless of isolation status.